Hey guys, it's Caesar with Nursing School Made Easy, and today's lecture is going to be on intussusception. Now, with Hirschsprung's disease and intussusception, these are typically processes that affect kids, infants, babies. You will typically not see these in adults. Okay, so let's talk about intussusception. What is it? Well, let's again draw a little bit of anatomy here, and excuse my crude drawing. So this is my drawing of a baby. Here's mouth, esophagus, we get to the stomach. Okay, and again we're going to go to small bowel, we're going to go to large bowel, and then here we go into the transverse, or excuse me, the ascending colon. Notice that is in the right side, okay, and heading towards the right upper quadrant. So again, here we go with large bowel. Then we'll go into the transverse colon, descending colon, so on and so forth. Okay. Well, what intussusception is pretty much a folding of the bowel inside itself into itself. Okay, that's one way to remember intussusception. The bowel is going to go into itself, so it's going to come inside here. Well, let me just show you with the balloon here. So in intussusception, again, the bowel is going to go into itself, similar to this action here. Okay. Now, as you can see, when the bowel goes into itself, like so, remember that you have a lot of vasculature going to feed blood to your bowels. Okay, so you have blood. I mean, they're not going to be positioned this way, but I'm just kind of making a point to make some vessels here and here that are going to be feeding blood to the bowel. So if you can imagine those blood vessels being tied out here, feeding blood again to the bowel. Well, if that bowel goes into itself like that, what's going to happen to those blood vessels? They're going to become obstructed, they're going to become occluded, they're going to be pinched off. So what happens when you, for example, pinch off your finger? You stop circulation to the tip, right? Blood flow cannot go through. So one of the things that you worry about with intussusception is, for example, decrease of blood flow to the bowel. So let's remember that. Now let's get into our signs and symptoms. Fix my camera here. So signs and symptoms. Number one, make sure you know this for the nclex. Kids will typically show some colicky abdomen pain. And this is going to be severe pain, because again, you're stopping blood flow from going to that area. So this pain, you almost likely see these kids kind of turning into a fetal position and guarding that abdomen, because again, it is severe pain. You are cutting off circulation to that area, and if you do not intervene, that bowel will die. So this is a very, very important disease process that you'll want to treat immediately. So again, number one, signs and symptoms, colicky abdomen pain. So again, you'll see these patients typically in a fetal position, so their knees to their abdomen. Okay. Number two, food cannot get through because it's going to be backed up, because again, there's an obstruction. So one of the problems that they will have, or one of the signs and symptoms that they will show, will be vomiting. And you may see bile and fecal material in this vomit. Okay? So assess it. Assess the emesis that's coming out, because again, it may contain fecal material and bile. Number 4, you also want to assess the stools, because typically the stools will show a jelly-like consistency, and the stool may also appear to be bloody and filled with mucus. Okay, so again, you'd want to check the stools. Are they bloody? Is there excessive amounts of mucus? If so, they may have a jelly-like appearance. Number 5, their abdomen will be tender to touch. Of course, it's going to hurt. So if you go to push on it, they're going to be guarding that area. And again, nothing can get through, so their abdomen will be distended. And again, this tenderness will typically occur in the right upper quadrant. And you may even be able to feel a mass present, again, in the right upper quadrant. So again, the ascending colon will be here, the right side, and maybe typically up here in the right upper quadrant, okay? Now, interventions. Number 1, you will always check for changes in their vital signs, their blood pressure, their heart rate. Look for severe changes, because if those drop or they change dramatically, it can indicate a perforation has occurred. Okay, we talked about how the bowel is going to go into itself. Well, this may cause a rupture or a perforation. So patient may have a change in their mental status, severe pain. Again, changes in their blood pressure may occur. So again, you always want to monitor their vital signs, especially if they're in excruciating amounts of pain. Do not leave that patient unattended. You'll administer antibiotics to prevent infection from occurring, and again, this will be ordered by the physician. 3, administer IV fluids, especially if they've been throwing up a lot. 4, you'll place an NG tube and begin gastric suctioning. Again, most likely this will be distended and they will be full of gastric and maybe fecal matter, so you want to get rid of that. And you will do that by inserting an NG tube and providing some type of removal of those stomach contents. Now, these patients may also be sent to the radiology department. Something like an air enema may be performed. And in that study, what will happen is go to the radiology department and they will insert a tube through the rectum and they will pump either air or fluid into the sigmoid colon. It'll go up into the descending, so it's going to come back this way. Okay, now the hope is to pump it full of air or fluid so that it causes enough pressure to push that kink back out. So for example, if the bowel is into itself, that air and pressure will hopefully cause enough pressure to cause that to occur. Okay? Again, that will be in the radiology department with some maybe air or fluid pressure. If this is successful, then you will want to monitor the stools. Make sure they're passing quote-unquote normal stools. Make sure that there's no blood. Make sure that jelly-like appearance is gone. You're going to assess for bowel sounds. make sure those have returned. You're also going to reassess for pain. Now, if the imaging study is not successful, then you may need to prepare the patient for a surgical procedure. Okay. Now, if it is successful, however, then you will also prepare them for food for meals. You want to start them off on a clear liquid diet to begin with. Again, you would always avoid anything that has a red dye in it, because you do not want that to mimic blood. You do not want it to show up in stools and appear as blood.